Hello, my name is Dr. Matt Kearney. I am a GP and Executive Clinical Director at UCL Partners. I'm going to talk to you about UCLP Primrose, a proactive care framework to help improve care and outcomes for people with severe mental illness. The challenge we have is that people with severe mental illness, or SMI, die on average 10 to 20 years earlier than people without severe mental illness. Much of this premature mortality is due to heart attack and stroke and cancer, and this in turn is caused by common risk factors such as high blood pressure, high cholesterol and smoking. Now these risk factors are high impact but highly modifiable. For example, treatment to lower blood pressure or cholesterol and help to quit smoking substantially reduce the risk of developing and dying from these conditions. But optimal treatment in these conditions can be difficult to achieve in people with SMI. Indeed, late detection and undertreatment is common and is likely to explain much of the premature mortality in this population. So, what is UCLP Primrose? Well, it brings together two major innovations. Firstly, the UCL Partners proactive care frameworks that use risk stratification to identify patients who need priority management and deploy the wider primary care workforce to provide structured support for patient education, self-management and behaviour change. The second element of the innovation is Primrose A, an evidence-based approach to delivering intensive, tailored support for people with SMI that has been shown to deliver improvements in mental health and to reduce healthcare costs. So UCLP Primrose has been developed by primary care and mental health professionals in UCL Partners with patient and public support. In the UCLP Primrose pathway, patients with SMI are stratified into priority groups based on the clinical criteria so that they can be reviewed by clinicians in priority order and have their risk factors, such as poorly controlled blood pressure or untreated high cholesterol, have these risk factors optimised, because we know that this leads to a rapid reduction in risk of heart attack and stroke. In the physical health check, patients and their carers, where appropriate, receive structured support for self-management and behaviour change. For example, how to take your blood pressure, how to use your inhaler correctly, how to check your feet in diabetes, or how to recognise a COPD exacerbation when it occurs. And patients are also offered brief interventions and signposting to support behaviour change, for example, smoking cessation and physical activity. This proactive care is delivered by staff such as healthcare assistants. The framework includes guidance and resources to support these staff in consulting with patients who have severe mental illness, helping them to recognise wider health and social needs and to identify physical and mental health red flags, with clear pathways to clinicians, mental health professionals, social prescribers, care coordinators, etc. And the whole pathway is overseen by a mental health nurse to ensure that the patient's complexity is understood and that care and support for engagement throughout the pathway is coordinated. UCLP Primrose includes a wide range of resources, including search and stratification tools that are built for EMIS and System 1, guides and protocols, videos, digital tools for patients and staff, and guidance on training that staff will need to deliver the proactive care consultations. All of these resources are free to download and use from the UCL Partners website. So UCLP Primrose is about supporting primary care to do things differently, to deliver excellent care for patients who are at risk of dying early from highly preventable causes, by risk stratifying, mobilising the wider workforce, and targeting the real-world challenges we all have in caring for this vulnerable population. So please do look at the materials on the website, and I hope you find them helpful.